Good day, ladies and gentlemen. Our today's guest is the head and the founder of a World Association for Infectious Diseases and Immunological Disorders, professor from Italy, Susanna Esposito. Good day.
Good day to everybody.
Okay, and the first question sounds like that. Is this your first visit to Baku?
Yes, this is my first visit, and I think that this was a great opportunity because today we signed an agreement between the World Association for Infectious Diseases and Immunological Disorders, a society that I represent as a president, and that include opinion leaders that are researchers in different fields of infectious diseases, autoimmune disorders, immunology, pneumology, and allergology at a worldwide level. I think that my visit was a useful visit because despite I arrived just yesterday, we have time to visit the Azerbaijan University Hospital and to discuss future cooperations and then also to sign this kind of agreement.
And now please tell us what is the main aim of your visit to Azerbaijan, maybe in details.
My aim is to present the support that the World Association for Infectious Diseases and Immunological Disorders can give to the health system in Azerbaijan. So in my society we have, I can say, the best opinion leaders in the field of infectious diseases and immunology, but also autoimmune disorders of the world. And we think that Azerbaijan is an emerging country with very good equipments and also machines and also training programs. But I think that we can do something in increasing the levels of knowledge, especially for young doctors, for nurses, but also for senior doctors that would like to specialize in advanced medicine. And for this reason, I'm here because we have discussed the possibility to have training programs of doctors and nurses from Azerbaijan in foreign countries. So this was my aim, and I hope that in the next months it will be possible to start at least with these training programs and then also with the educational courses in Baku and also with big meetings in this city.
By the way, what is the main aim and goal of your organization? Can you explain to us?
The society that I represent is a sort of network between different scientific societies. So the society includes members from the European Respiratory Society, the European Society for Clinical Microbiology and Infectious Diseases, pediatric societies like the European Society for Pediatric Infections, the American Academy of Pediatrics, and also other society in the field of rheumatologists and autoimmune diseases. And the aim is to create a sort of network that can permit to increase knowledge in diseases that are in between the infectious field and the immunologic fields. And in fact, sometimes it can be difficult in a patient to understand the etiology of a disease. And with the WIRID, we have created a service of clinical advice that will be available starting from the beginning of March, in which all the doctors that are registered to the society can send through website their medical questions to the most important experts in the specific fields, and they will receive a support and an answer within 48 hours. This is extremely important because you can have a patient with a disease that is uncommon in your country, but it is very common in another country.
You wanted to organize such trainings here in Baku?
We organize the training that can be of a period of 3 to up to 6 months, probably in Italy. So we have proposed Italy as a country that can support this kind of training because the Italian university professors are very interested in this project. And we can create this training in Italy with a YDID that will check the level of knowledge at the beginning and the final level of knowledge with examination and with a certificate that is given on behalf of the YDID. So it is not just a training as can happen sometimes, but it's a training with a worldwide certificate of what has been learned and what has been done during this period.
What have you achieved during this process of during the training?
Yeah, according to the person, because the person can be a doctor or a nurse or even a student. So
a junior doctor maybe, yeah?
Yes, I think that we should define the level of achievement according to the specialty of the person and his or her characteristics.
In other words, you want to share your experience with us, yeah?
Yes. Of course, Italy is a country that is very interested in this kind of project, but again, in YDID we have also experts from the United States, from South America, from South Africa, from different European countries, and this can permit also to share a worldwide view of different aspects of medicine. Azerbaijan is really a country that has the desire to increase. There are good structures, and also the level of the population is good. Probably it is needed to support the persons that are very interested in increasing in their knowledge, and so the possibility to organize this kind of trainings is extremely important also to reduce the medical tourism that you have in the country. I know, for example, that for some diseases there are important people from Azerbaijan that go outside for for treatment and for the diagnosis of different diseases.
By the way, who helps you implement your project?
I'm here also to identify the person that can support in this project. I think that also the First Lady here in Azerbaijan is very interested in health projects. I will not meet the First Lady, but I hope that she will be informed of our project and she will be interested in moving towards its realization.
By the way, what are the main dangers infection diseases are nowadays? Can you tell us?
Of course, there are some emerging diseases nowadays that are like all diseases that are now emerging as an important issues. For example, tuberculosis is one of these. Anyway, we have problems also with vaccine-preventable diseases. For example, measles and rubella, that are a priority for WHO. I am also the chairperson of the WHO Committee for Elimination of Measles and Rubella from the European regions, and we still have several cases of measles and rubella in different European countries. I think that we have new pathogens that are emerging, all pathogens that are again we can say on fashion in a certain way. Then of course we have new treatments, new drugs, but this means that even the correct administration of antibiotics and anti-infective agents is extremely important in order to avoid resistance. So the problem of antibacterial resistance is very relevant. First of all, that we need a correct diagnosis with advanced methods to identify the pathogens and the resistance. Second, to use appropriately the antimicrobial therapy and anti-infective therapy when there is an infection. And then third, to know the problem of resistance and to know how to control these problems, how to reduce the risk of resistance, and how to treat the cases that are really resistant and at the end require an aggressive treatment.
You mentioned Ebola, and I think that it's one of the most dangerous infectious diseases nowadays. And by the way, how can we protect ourselves? Because it's spreading so fast. I
think that Ebola is mainly a problem related to a specific geographic area. So, of course, from in the west part of Africa, and then in the west part of Africa, probably the possibility to control the spread of the infections are lower than in other countries. And the transmission is extremely high among healthcare personnel. So the problem is for healthcare workers that go in Africa to give an help, and then in these countries the risk of transmission of disease is very high. So it's not really a problem for every person, whereas other diseases like, for example, tuberculosis are becoming a problem because the transmission is extremely high just with respiratory secretions. Now there are new pneumococcal vaccinations that can be given in the elderly and can reduce the risk of pneumonia and also of invasive pneumococcal disease. So there are also new possibilities in the prevention field, and it is very important to know this possibility and to use appropriately them.
Some parents they refuse to vaccinate their children because they think that vaccines are harmful for their health. What do you think about it?
I think that the vaccines have totally changed the health in the pediatric age. So this is the first point, because in countries with a high vaccination coverage, we have a significant reduction in the number of infectious diseases with an increase in the health of the population. So at the end, vaccines have really changed what the pediatricians see in the everyday life in some countries. And for this reason, I think that parents should know the risk of the disease and should be adequately informed of the benefits of the vaccine and on the fact that the vaccine can really save several lives.
And the last question is about how can we improve our immune system?
There are different ways. Of course, I think that the priority is vaccination. So the fact that there is now the possibility to prevent with vaccines several infectious diseases is extremely important. So we should increase our protection against the infectious diseases with an appropriate use of the vaccination. Then, of course, there is the possibility, in case of, not really new deficiency, but frequent infections, to increase the efficacy of the immune system using some types of immunostimulants. The two products for which there are data are OM85BV and pidotimod that should be taken for 10 days for 3 up to 6 consecutive months during the period with the highest risk of infection. Then, for example, vitamin D appeared as a potential immunomodulator agent, and it can be given in order to increase the strength of the immune system. Of course, there are people that are receiving drugs for medical reasons that cause immunosuppression, and in this case the possibilities to increase the efficiency of the immune system are reduced because they have an immunodeficiency. In this case, it is very important to vaccinate them and also their household members.
Thank you very much for a very interesting interview.
Thank you very much.